Hello, welcome back. Thank you so much for joining me. Since doing my video about mitochondrial disease a couple weeks ago, many people have been asking how I'm currently doing. Now I always feel like this is a million-dollar question. How can I sum up my health in a few short, simple sentences? When living a life with a ventilator and having medical conditions, my health is constantly changing. Something which may be plaguing me today may be but a distant memory a few weeks from now. For the moment, the two major issues which are a constant challenge are pancreatitis and Pseudomonas. September 25th, 2008 was the last time I ever ate a meal without having severe GI upset or food restrictions. From that moment forward, multiple GI issues have plagued my body. Although I've had numerous different diagnoses, such as gastroparesis, delayed GI transit, and chronic intestinal pseudo-obstruction, the root cause of all my issues was my pancreas. From 2010 to 2011, I lost about 60 pounds due to severe pain and nausea whenever I ate. After doing extensive research, I finally figured out what was causing me. I was having pancreatitis attacks. This happened especially anytime I ate protein or fat. In 2011, I took this information to my GI doctor. However, he dismissed this information at once. No, he told me, my pancreas couldn't possibly be causing all my issues. I, however, thought it was my pancreas. On the way home from his office, I stopped at the grocery store and bought a small 3-ounce piece of salmon. I went home and I cooked it and I ate it and I was lovely and glorious. I loved every bite. But 4 hours later, I was in the emergency room with a pancreatitis attack. Then my GI doctor finally believed perhaps it was my pancreas causing all my issues. In 2012, my GI doctor referred me on to a pancreas specialist. The pancreas specialist did a procedure called an ERCP. ERCP stands for endoscopic retrograde cholangiopancreatography. To perform an ERCP, an endoscope is placed into your mouth, down your throat, through your stomach, and into the first part of your small intestine. Now, once the scope is in the first part of your small intestine, dye is injected into your pancreas duct as well as your bile duct. This helps illuminate if there's any blockages or any narrowing of any passages. Also, during the ERCP, a special attachment on the endoscope can allow the scope to travel from the small intestine up into the biliary ducts. This can travel into the pancreas, up into the gallbladder, or ultimately up into the liver. A special attachment can also measure the pressures within these ducts. Tissue samples can be collected and stones and cysts can be removed. During the ERCP, the following was found. I had high pressure in my bile ducts. My doctor placed stents into my bile ducts to help keep them open and help keep them from collapsing. It was also found that my sphincter of Oddi down here was dysfunctional. This was causing my sphincter of Oddi not to relax at the proper times, which was causing pancreatic enzymes to build up within my pancreas. This was causing the pancreatitis attacks. Once the sphincter of Oddi was cut, it was hopeful that my pancreatitis attacks would cease and everything would resume back to normal. The ERCP procedure worked for a couple months, but then suddenly my liver enzymes were sky high, and once again I was having pancreatitis attacks. So not knowing what else to do, my GI doctor sent me back to the pancreas specialist, and I had another ERCP procedure done. During my second ERCP, the following was found. I had high pressure in my liver bile ducts. The doctor this time placed more stents, but this time in my liver bile ducts, and this was in hopes to keep everything flowing from my liver down into my small intestine. Finally, after having the second ERCP, I could eat again. But now I could only eat fruits, vegetables, and a small amount of dairy. Anything high in fat, protein, or sugar sent my pancreas into a wild pancreatitis attack. In early of 2018, I again had major pancreas pain anytime I ate. I lost a tremendous amount of weight due to severe pain and nausea. I went back to the same doctor who did the 2 previous ERCP procedures back in 2012. However, this time, he refused to do any more ERCPs. Instead, I had to find a new GI doctor. Finally, in July of 2018, I found a doctor willing to do another ERCP procedure. So once again, I had the procedure done. This time, the doctor again found that my ducts needed to be cented open, as well as my sphincters cut. and he also found a 1-inch cyst blocking my main pancreatic duct. This meant all the digestive enzymes being released by my pancreas were not being allowed to flow into my small intestines to digest the food. This meant food was not being digested, which was causing severe pain and bloating, as well as all the digestive enzymes were being released only into my pancreas and were digesting my pancreas. Yes, my body was actually digesting and eating away my pancreas. This was what was causing the tremendous pain and nausea. After I had the procedure done, I was severely sick for the next 2 to 3 months. I could barely eat and continue to lose a significant amount of weight. However, thankfully, after about 3 months, my body finally responded to the procedure and again, finally repaired itself. And again, I was able to eat. But again, only I was able to eat fruits, vegetables, and small amounts of dairy. Anytime I ate anything with high amounts of fat, protein, or sugar, I again would experience pancreatitis attacks. This all worked again until February of this year. Suddenly I found myself to be severely bloated anytime I ate. I would feel very, very nauseous and I didn't know what was wrong. And finally, the pain started. The pain started in about March and I was having the severe pancreas pain anytime I ate and I went, oh no, this is happening again. So every day it's always a challenge. Some days I can eat and some days I can't. Some days I can eat small amounts of food and be fine, and other days I simply can't eat anything because the pain, the nausea, and just the bloating in my GI tract is so severe. All I can do is curl up in a ball and wait for the pain to pass. Sometimes the pain lasts for a couple hours, sometimes for a couple days, and sometimes for a week at a time. And when this happens, I cannot eat anything. All I can do is sip tiny, tiny amounts of water. I know another ERCP procedures in my future, but for the moment, I've only lost a small amount of weight. When I again begin losing significant amount of weight and begin having significant chronic intense pain that I simply cannot stand, I'll again seek out my GI doctor and schedule another ERCP procedure. But for the moment, I'll delay having this for as long as possible. And this is due to several factors. First of all elective procedures have been canceled in the city in which I need to have this procedure done. So even if I needed a procedure right now, I simply couldn't have this done. But hopefully in another 1 to 2 months, everything will resume back to normal. Secondly, this procedure is extremely hard on my body. Every time I have an ERCP, I experience horrible pancreatitis attacks, and this lasts anywhere from 1 week to several months afterwards. Now, this is a major ordeal for my body, and I again want to delay this as long as possible. And lastly, having an ERCP means I'll be switched over to a hospital ventilator. Now, this happens because I need to have general anesthesia anytime I have an ERCP. Hospital ventilators cannot be sterilized. Now, you can change the tubing, which they do between every patient, and this is sterilized. However, the inside of ventilators cannot be sterilized. This means hospital ventilators harbor bacteria and viruses. Since many hospital ventilators are currently being used for the coronavirus, this means most hospital ventilators are currently infected with the coronavirus. So now, anytime I'll be switched over to a hospital ventilator, there's a serious risk that I'll develop coronavirus from the ventilator. Now, for the moment, I want to try to continue to delay this as far as possible. This means that as people get out of the hospitals and hopefully coronavirus goes to a minimal, hopefully less and less people are in the hospital and less people are in the ventilators. And this, again, will give the ventilators time to rest, and hopefully that during that resting time, the ventilators will no longer harbor the coronavirus as it'll die over time. And this brings me to Pseudomonas. In July of 2018, when I was having my 3rd ERCP procedure, I was switched over to a hospital ventilator. Upon recovering from the procedure, I could tell something was definitely wrong with my sputum. Now, sputum is the stuff you cough up from your airways. Most people cough it up into their mouth and then spit it out. When you have a trach, the sputum comes from your airways and it goes up to your trach and into your tubing. Of course, when you have a trach, you're constantly coughing up lots and lots of sputum, and you're always aware of the color, the taste, the texture, and the smell of your sputum. Now, if any of these change, you know something is different with your airways. Upon recovering from my procedure, I could definitely tell my sputum had changed. I had new sputum cultures, which revealed I now had a bacteria called Pseudomonas. Despite being very, very sick and being in the hospital, I was only given 2 days of antibiotics. I then was sent home with nothing. They simply said, it's a colonization and it's going to always be in your airways and there's nothing else we can do. I didn't believe this for a moment. I knew I was severely sick, but what could I do? So I went home and hoped for the best. 2.5 weeks later, I became severely sick. I was rushed to the hospital and upon admittance, they found I had a hole in my right lung about this size that the Pseudomonas bacteria had eaten away. This time, they knew it was a serious infection, and this time I was hospitalized for 12 days. I subsequently was started on IV antibiotics and was given a central line. And this brings me to my Pseudomonas story. I've continued to fight this bacteria for the last 2 years. I've had multiple holes in my lungs as well as sepsis from this bacteria. I've been required to go into the hospital multiple times, and due to these frequent hospitalizations, I've also developed other hospital-acquired bacteria in my lungs. I've had 2 anaphylactic reactions to the antibiotics given, as well as I've had central lines which have also developed serious infections. If I get a long dose of antibiotics, I can go about 4 months without need to be in the hospital. However, once these antibiotics wear off, I again become sick and need to go right back to the hospital for more IV antibiotics. Lately, I've been having good days and bad days. Some days my airways swell up and I find myself coughing and unable to breathe, and the sputum is clogging my airways. And other days, I'm just fine. I know time will tell how this infection will progress. But for the moment, I'm nearing 4 months since my last hospitalization and approximately 3 months since my last course of IV antibiotics. I'm hoping and praying that this bacterial infection called Pseudomonas will take a break for once. Just take a vacation, Pseudomonas. Go away. Go enjoy yourself to another land, to some distant place. But time will definitely tell how sick I'll get. One day I can be feeling fine, and I know the next minute Pseudomonas can make me very sick, and I have to go to the hospital and be on a very long course of IV antibiotics. So this is just a brief update on how my health is. Basically, my pancreas is the main issue, which is plaguing me every day. It's making it severely difficult for me to eat, and it's causing a tremendous amount of pain. But for the moment, I'm dealing with it as best I can. I know whatever happens, God will pave the path before me. If I need to go to the hospital, He'll be there directing my course. And if I can stay home for a while, I'll rejoice in that every day. Thank you so much for joining me again. I hope you like and subscribe. I hope you have a wonderful day and a wonderful week. See you again very soon. Bye-bye.